Hello everyone, welcome back to another session of Cancer Care at American Oncology Institute. And today we have Dr. Burhan Wani with us, Senior Consultant, Department of Medical Oncology. Sir, having a 10 years of experience in management of solid and hematological cancer. Sir is a member of the several national and international oncology society with research paper in several national and international journals. So today's the topic we will discuss about the kidney cancer. So sir, what is the kidney cancer and how it is common in the society?
Thank you, Jyoti, for having me today. Regarding the kidney cancers, kidney cancers are the cancers which arise in the kidneys. So, as you know that all of us have two kidneys in us, and the kidneys are located in the abdomen. And these kidneys, they are important for maintaining our daily, we can say, to help us in various sort of functioning in the body. They are very important for the normal body function. They help in the excretion of the various metabolic products. They are also very important in maintaining the various what we call electrolyte balances in the body. Also play an important role in maintaining the blood pressure in our body. So they are very important as far as the normal function of the body is concerned. So the cancers which arise in the kidneys are referred to as the kidney cancers. So if we see the kidney cancers, almost 90% of the kidney cancers, they are what we call as the renal cell carcinoma. So renal cell carcinoma is the most common type of the kidney cancers, and it is usually seen in 5th to 6th decade of the life. Now, if we say the common, how common are the kidney cancers? They are not that common. So, if we see of all the cancers, the kidney cancers, they account for 2% of all the cancers that are diagnosed. And the kidney cancers, they are, as of now, 14th most common cancers that are diagnosed.
Okay. So sir, my next question is, what are the common risk factors for kidney cancers?
Okay. So if we see the kidney cancer, the risk factors that has been seen in various studies, these include the most common being the tobacco smoking. So tobacco smoking, it has been seen to significantly increase the risk of the kidney cancers. Other important risk factors include obesity and having a hypertension. So these are the common risk factors as far as the kidney cancers is concerned. Now there are other risk factors as well that has been found to have some association with the kidney cancers. These include alcohol consumption, having what we call as diabetes, patients who are on who have chronic kidney diseases, or patients who are on hemodialysis. There is another set of kidney cancers where there is some family risk. So if there is a family history of kidney cancers, there are chances that an individual may be at increased risk of having a kidney cancers.
So sir, what is the sign and symptom of kidney cancer that people should watch out for?
Yes. So coming to the signs and symptoms of the kidney cancers, the problem with kidney cancers is majority of the kidney cancer, they tend to be silent in the early stages. So once this kidney cancer starts, many patients might not have any signs and symptoms. And it may only be once they have increased significantly that the signs and symptoms may appear. So coming to the most common signs and symptoms that we see in these patients, these include first most common is having a blood in the urine. So if there is blood in the urine, what we call as hematuria, this may be the first symptom or the common symptom of the kidney cancers. Other symptoms include having a pain which may be present in the abdomen. It may most of the time is a dull aching type of pain that may be present in the lateral part of the abdomen. Other symptoms could be if there what we call as a lump, presence of a lump or a swelling on the lateral side of the abdomen. Now there are other non-specific symptoms which include having a fever or weight loss or loss of appetite. So these are some of the symptoms as far as the kidney cancers is concerned. Now, other symptoms can also be present for renal cancers if they have spread to other organs. So commonly we see that around 30% of patients, they may present with the symptom where the cancer has spread to the other organs, like they have spread to lungs, they have spread to bones, or in some cases they have spread to the brain. So these may be if they have spread to these organs, they may present with the symptoms that may be related to these organs.
So, sir, how kidney cancer is diagnosed?
So, if we see how to diagnose these cancers, there are various investigations that we do for diagnosing the kidney cancer. The routine investigation that we do include a ultrasound of the abdomen. So we do a abdominal ultrasound, and by doing it, we may check any abnormality if there is in the kidneys. So which include if there is any sort of swelling or what we call as any sort of mass that may be present in the kidneys, that may give us a little bit of idea that if we are dealing with the kidney cancers. Now, if we are suspecting, there's a high suspicion based on the ultrasound that we are dealing with some mass in the kidneys, then we look at more sophisticated investigation. These includes the CT scan of the abdomen, or what we have even better is the MRI of the abdomen that gives us a better as far as the picture of the renal mass is concerned, and whether this renal mass is related can be cancerous or it is a non-cancerous kidney mass. So suppose if we are finding a kidney mass and it looks to be malignant, what you call as the cancerous, so we have to do, the most important thing is to do further to see how much is the spread. So what is the spread of this disease? So for this we may do some other scans. So this may be a routine CT scan, so we may do a CT scan of the chest to find whether they have spread to the lungs, or we may do bone scan. As of now, we have even a better scan, what we call as a PET scan, which scans whole of the body, and that gives a better idea about whether this disease has spread to the other organs. Another important thing what we have to remember is that if on the scans we are finding a mass, renal mass, and that is likely a cancerous, we try to avoid doing a biopsy. So as you have seen that for other cancers, we are doing routinely the biopsy. But kidney cancer is one of the cancers where we try to avoid doing the biopsy at the outset if it is localized to the kidneys. The reason being that it has been found that doing a biopsy can lead to the splage and lead to the seeding of this tumor, and it is avoided. So this is how the kidney cancers are diagnosed.
Okay, sir. So, sir, my next question about the treatment. What are the option of treatment is available for kidney cancer?
So as I mentioned you that once any patient of kidney cancer is being diagnosed, the most important thing that decides the treatment is about the stage of the disease. By stage, we mean how much the disease has spread from its site of origin. So there are staging classifications. So commonly we refer to them as localized, where the kidney cancers are localized to the kidneys, or what we call locally advanced, where it has spread to the other sites, like it has spread to the nodes, neighboring nodes, or one of the peculiarity of the kidney cancer is that it spreads to the veins. So through the veins, it spreads to the through the veins into the what we call into larger veins. So whether it has gone into those veins. Then another thing can be what we call as a metastatic. Metastatic by means that if it has spread to other organs, like it has spread to lungs, it has spread to the bones, where is the common site. So depending upon the staging, the management or the treatment is decided. So if it is most of the times localized or locally advanced, the best modality of treatment is the surgery. And there are a number of surgical or treatment modality, surgical options that we do. One of the, if it is localized, as I mentioned, that is localized, we can still, it is not necessary always to remove all the kidney. So we can do what we call as the removal of the mass along with a small amount of the normal tissue. which we call as the partial nephrectomy, and help we actually at the same time preserve some of the renal function as well. So this is called as partial nephrectomy. This is possible in some of the tumors depending upon the location of the tumor and the size of the tumor. Now, if based on the size and the location, it is not possible to do partial nephrectomy, then another option is the radical nephrectomy, where we completely remove the kidney altogether, the involved kidney is removed. And another important thing is that there are other non-surgical options also available for a localized, what you call as the limited cancers, where the cancer is limited to the kidneys. These include the thermal ablation procedures that are currently available, and they are commonly being done for smaller tumors. If the tumor is less than 3 centimeters in size, or if it is peripheral, if it is located on a peripherally. So we use options like thermal ablation in the form of either radiofrequency ablation, or another option is cryo. So using a very low temperature through a probe, it is being used, and which leads to the death of these cancer cells. So these are as far as the option for the limited cancer is concerned. Now, if it has spread, then there is other option, what we call as the medical option. So medical options can be, there are some other drugs that are being used for the management of the metastatic kidney cancers.
So, sir, is there any new or emerging treatment for this disease?
Yes. So if we see a decade or back, a decade earlier, there were very few options as far as the management of the kidney cancer was concerned. So mostly, as I mentioned, that the surgery was being done, and it was found that even on patient by surgery, after the surgery, the problem was some of these patients had a recurrence. They may present with again the disease will recur, not in there, but in the other sites. So after the surgery, there is currently what we call as the adjuvant therapy. So we are giving some treatment to reduce the recurrence so that it does not come back. So we have now the availability of what we call as drugs, immunotherapy. So immunotherapy, it is a newer modality of the treatment by which we are reducing significantly the recurrence of the high-risk renal tumors after the surgery. Now, as you mentioned about the some other evolving, so we have, as you know, that kidney cancers, they tend to be chemorefractory. So it is one of the cancers where chemotherapy does not help us much. So there are options in the form of targeted therapy, or which are in the form of oral some medications that are available that target particular proteins, and that in turn lead to the what you call as the killing of these cells. Then the immunotherapy, as I told you, immunotherapy are these are the again in various this is the modality by which the body's immune system is primed, and it in turn leads to the destruction of these cancer cells. And with these modalities, with these newer modalities, even they are being used in combination in high-risk cases where the targeted and the immunotherapy is combined together, and it has been led to even better survival. And even patients that are metastatic, that have spread out disease, they can live for years together. So that was unheard of previously. So these are the newer options as far as the management of kidney cancer is concerned.
So, sir, are there any lifestyle changes or preventive measures that can reduce the risk of developing this type of cancer?
Yeah. So as I mentioned to you that there are risk factors. So if we reduce these risk factors in our daily life, so definitely it may help us in reducing the risk of the developing the kidney cancer. The most important being the cigarette smoking. So we have to try to, as much as possible, try to tell in our community, so that we can actually reduce or stop altogether the smoking activity. So if we are doing it, so it can significantly help in reduction of the kidney cancer and other cancers as well. Also, as we mentioned, obesity. So maintaining a good weight, so you can say healthy weight, and having a diet that is low in carbohydrates, low in fats. It has also been found to reduce significantly the risk of developing the kidney cancers. Also, there are factors like if the patient is, like we have mentioned, hypertension. Hypertension is also a risk factor. So, controlling the hypertension by reducing the salt intake, having good physical activity, all of these have been found to significantly lead to a reduction in the various cancers, and kidney cancers are no exception.
Thank you, sir. Thank you for the lightning on the kidney cancer. We have a very informative session with the Dr. Burhan Banings. Thank you so much.